Welcome to The Bridge, a podcast for dental professionals featuring the insights and expertise of fellow dental professionals. Let's welcome our host, Stephen Kuza.
Hello, Bridge Dental Podcast listeners. This is Steve Kuza, your resident dentist, financial advisor. How is everybody doing today? We got a special guest, Dr. Alvin Daboul from Royal Oak, Michigan. Dr. Daboul, how are you doing
Steve,
today?
how are you? I'm awesome. Thanks for having me on the show today, Steve.
Thanks for taking time out of your insane schedule. We'll talk about that today and jumping on with us for a few minutes to broadcast to the dental world some really cool topics. And for those of you listening, what we're going to go through today, Dr. Daboul has a couple different specializations, and we only have so much time with him. We're going to really dive into dental sales, how to communicate with patients, and making sure that your systems are correct in place when you are communicating with patients regarding the care that they need. But Dr. Daboul, let's land this plane a little bit, help people understand who you are, where you're at, and we'll kind of take it from there.
Okay. Well, my name is Alvin Daboul. I have a practice in Royal Oak, Michigan, over on 13 and Rochester Road. I've been there since 2008 when we opened the practice. Just, really happy to have a great team that surrounds me and some great, dentists that surround me. And I live in the Bloomfield Township, and it's just basically who I am. I got 4 kids at home, 4 boys, so yep. Everyone always says, God bless your wife.
God bless your wife.
Because she's got me to deal with as well. And and I just really enjoy and love what I do.
Thank you. Well, Alvin, a couple of things for the podcast listeners. I know you really well. Obviously, you and I are connected through family. We are family in cousin related ways. And also you are my dentist. So finally, Bridge Dental Podcast listeners, I got my dentist to jump on here. So I'm very excited about that. And when I met you, your practice was completely, I guess that's how I'll describe it. So it looks somewhat similar, but it's completely different from when I met you originally and started coming to your office to where it's at now. How many rooms are you at? Like, how many rooms do you guys have now? What's the staff structure like? Just out of curiosity.
And you're completely different since you started coming to me, Steve.
That's true.
So I want to commend you on your success and
Thank you.
The way you've grown and dove into the dental world and what you've done, man. So, right back at you. So we have 13 rooms in the office, 3 full-time hygienists, 3 full-time doctors. I was lucky I actually started the practice just doing all the hygiene myself, 1 dental assistant and 1 front desk, in 2008. And I was lucky, I partnered with a great group, Dr. Gashanowitz and Dr. Nemi, and they kind of, helped me get started at the practice. I came in as a partner with them. They taught me how to, market practice, how to, create systems and organize. So I was partners with them for about 7 years, grew the practice together. In the meantime, I mentored other dentists, opened locations with them, and, just helped other dentists get to their next, home and create a place for them. After about 7 years of being with them, I wanted to, create my own culture, my own vision. So we, worked out a deal where I bought my location that I'm at from them and sold out of the other locations. So I'm blessed to, own it 100% now. And so that's where we are, and it was, great systems and great, as the topic is sales, right? Great communication with patients and great culture that's, helped us get to where we are now. And I've, created my own culture and my own systems as well, different than what I learned with them. Right. Sure. So I've also gotten other, mentors and guidance from other people as well. So everything I do, some things will be my idea. Right. But the majority of anything that I've done is something I've learned from someone who's been there, done that, or from a coach or an advisor that had some great ideas that I just had to take and implement, really.
And because they've done it before, right? It's easier to steal it. And I say steal it, but they're lending it in a sense to the next generation. So I've stolen plenty of
always
ideas.
Wanted to surround myself around people who I wanted to be like.
Correct.
Right? So you don't surround yourself around. Yes, you do. You have all kinds of friends and family, But when it comes to like business or you're trying to achieve, you're trying to find somebody that like, okay, what have you accomplished? What can I learn from you? Right.
Correct.
And that's a philosophy I've always taken on. And even now, I'm always trying to surround myself around dentists who are better than me, right? Who can do things that I can't do, who can even add more value to my practice, right? So you never want to think you know everything or, you know, you're the smartest guy in the room, because if you are, you're not surrounding yourself around the right people, right?
You know, you mentioned that, and you think about the staff that you have in place now, Alvin, and where you're at today. You and I were kind of chatting before the podcast, and we were laughing about it, and I like threw out an insane number, and you're like, no, that's about right, about the amount of patients you see a week. And the reason I'm bringing that up is that where I want to connect this dot is your practice. You seem to have maximized your location, and I think the better word is optimize your location, and you've done it in one spot. You know, so if you want to increase sales, a lot of times dentists open another location, and it seems like you've optimized your ability to produce at your office in Royal Oak with being creative with your actual location, creating additional rooms, with bringing in 3 full-time dentists, et cetera, you know, even with the implant stuff that you're doing now. So I actually want to touch on that a little bit. Why did you, before we get into the actual execution, but why did you not say, all right, let me get this practice going, then I'm going to buy practice number 2, number 3, number 4, number 5, which I see that's a trend also. Tell me about that a little bit and break that down for us, your decision-making to optimize one location versus branching it out.
Yeah. And I like the correction of the word. It's not maximized by all means, right? You could always figure out a way to maximize more, but we are optimizing this location. And we still have room for growth. Okay.
Sure.
So I'm still trying to grow to the next level within this location as well. So, you know, I've experienced both. Okay. And it's not that I'm not going to be working on more locations in the future. I actually have one place under contract right now that I'm looking at with a younger dentist that we're going to partner together. And I can, you know, that whole setup and philosophy we can talk about later or another podcast, you know, how we're trying to optimize that together. But, you know, when you have a big enough facility and you have room to grow, or even if you don't have a big enough facility and you can move your facility once you've grown, you know, your overhead and control is so much better under one place. Okay. Right. For me. And, you know, until you can optimize and fully maximize that facility, for me, it's like, why do I want to go spread myself thin somewhere else when I have so much more growth to do here? Okay. And this is different than somebody who's opening several locations, because it really depends on your goal and your vision, what you're trying to accomplish. Okay. If
right,
my goal and
that's a bad route,
because my goal and vision is I want to be in my practice. I want to be with my staff. I want to create a very tight culture here. I want very long-term staff here. Right. I mean, most of my staff, they're 10, 12, 13 years with me.
Yeah, that's awesome.
I've got 4 people over 10 years. I've got 5 people over 8 years, another 5 over 5 years. You know what I mean?
Yeah.
And, you know, the quality of what I'm seeing, it's all in front of me. Okay. And I can go in a meeting in the morning in our morning huddle, and I can just look around the room and see, okay, you know, who needs a little talking to, a little motivation, or who looks like they might have something going on. And I'm there every day and I can see it and I can pull them aside and say, hey, what's going on? You know, what can I help you with? And then we solve the problem and get them back happy. You know,
right.
Happy employees are, you know, productive ones, right? If they have a lot of other issues going on, they can't concentrate on work. Okay. Or personal problems within the practice. So, you know, you might have somebody else whose goal is to, you know, not do dentistry and maybe just like manage. Then, you know, that in that case, you got to open several locations.
Correct.
To supplement your income, because our income as a dentist is the best income we can make. Right. And
your ability to earn money for sure.
100%. Right. So, I mean, last year I took time, like I went through a phase where I'm like, okay, I'm only going to do dentistry 2 days a week. So I did that for about a year. And I just managed the other days a week, right? And then other investments came in, you know, in my life where I wanted to invest in real estate or something, okay? All of a sudden I'm broke again, right? And it's like, okay, well, if I'm going to make good income, I got to do dentistry. Right. So a lot of dentists out there, they understand what I'm saying. You guys get it. Like, you need to do the dentistry to make the good income. It doesn't mean you have to. You could open several locations and you can make a little bit of income out of each location, but you have to have several to supplement your income as a dentist. So,
well, Alvin, I want to go back to one thing you said, though. You mentioned you had a vision. Your vision about your office, the type of culture, the people. That's what, allowed you to pursue this build out that you have now, this optimized practice in North Oaks, versus if you have a different vision, to your point, I want to be the CEO of several practices and place dentists in there. And you're also kind of acting on that part of your vision too. But I think that what you mentioned is really important, is you had a vision first and you knew where you were going, and that's what you drove towards. Because I watched it. I saw you hire, if I remember correctly, not only did you have mentors, but I saw you hire a consultant. Like you poured into your vision because you knew what you wanted. Is that accurate? When I bring that up about you had the clarity about what you were going to do?
Yeah, absolutely. And the consultants I brought in, their management style and the way that they consult lined up with my vision. Right. So you can't hire a consultant that doesn't line up with your same ideas and philosophy. Right. So you got to kind of interview them out there. I actually, I learned a lot when it comes to systems, and, with Brightside Dental, we had a huge training systems. And then I brought in Sean Crabtree, the Crabtree group. Once I went solo, I've had experience with him in the past. And, he really had tied down exactly what I'm looking for. Right. And now I'm kind of, creating my own type of vision, but with the combination of everything I've learned between all my mentors and training, right? I've invested, since I've been in dentistry, probably $200,000 or $300,000 just on, not marketing, but sales and communication training and staff training. Right. And, that's what's helped me develop what I have now. And it's smooth the way it is.
So let's talk about that, because that was our theme of understanding the dental communication is why it's so important to a patient, because it's not I don't mean this in a bad, there's no more drill and fill. This is patients are coming to you for so many different things, and dentistry is becoming more complex on how to communicate the right procedures that a patient might need, whether it's cosmetic or actually needed. Right. So with all these systems, let's try to get down to the bare bones of this, and then we'll kind of build up from there. When you think about dental communication, whether it's an implant, whether it's cosmetic, or whether it's just treatment that they actually need, to make progress in their dental care, where do you start? When let's say you're in the growth of an office, tell us how you've evolved, where it started, and how you guys have evolved. Kind of, let's bridge those 2 points.
Sure. So let me take a step back to help with where we're going to get into this conversation, because I'll talk about where it's not too.
Okay.
Yeah. Because in my opinion, this is my opinion, right? Everybody has their own experiences. Everybody has experienced different ways, and there's way more than one way to be successful. Okay. As long as you're following a system when it comes to treatment acceptance or running your practice or culture in the office, as long as you have a system that you're following, you can be successful in that system. That's what I believe completely. Okay. But it's when you're just doing something different every time, okay, is when you kind of lose that success. And, when you have a system, you can, hire and train amazing staff to implement that system. And the better the staff is trained and the better of a person they are or ability they have, the better that system is going to run. Right. But without that system, you're not giving them all the tools they need. They're just trying to figure it out. Okay. Right. And then when it's time for that employee to move on to another practice that you're growing, or they have a life event and they have to, move, or they leave your practice to bring somebody else in, when you have the system, it's way easier to just plug them into the system that you already have, and they can be successful, almost immediately.
Right.
Or within a month or two of training. Okay. So, when we talk about communication, it starts with the system. It starts with the phone call when the patient calls the office, where a lot of people think it starts in the chair, right?
Right. That's where my brain went. So I'm glad you brought that up. So let's talk through that.
By all means, most training when it comes to communication is just the dentist talking to the patient, right? My communication with the patient is probably, where we do the least amount of training, right? Okay. However, I have had a lot of training in that communication so that when my treatment planner hands off to me what we're doing with the patient in front of the patient, I can recognize where I need to continue to communicate and ask more questions to.
Makes sense.
The other thing is for our practice, we don't do a lot of cosmetic, veneers, cosmetic work like that. The cosmetic work we do is like dental implants, mainly like the patient who's got just broken down mouth and they need a full arch of dental implants. That's our major cosmetic stuff because we're taking someone who's just completely broken down to a new person, a new smile, which is we love. We also do IV sedation in the office. That's like the one thing that other dentists refer to me is IV sedation more than anything. Because we're able to, I went to Duquesne University and got certified, to do IV sedation in Michigan. However, I delegated to a certified nurse anesthetist, right? Okay. So they sedate the patient while I do the work. So we do a lot of general dentistry under sedation, right? A lot of patients out there, can't get that done at their dentist. So if a dentist sees someone really needs that, they'll send them over to us. We'll help them. Wow. Also special needs, wisdom teeth or molars, whatever they need, we can help. But mainly most dentists will refer to us, general dentistry. Okay.
And Alvin, I want to go back though. So, cause I want to put a bookmark on that for a second and go back to, because what you just mentioned, what I want to put a bookmark is in the type of patients that you could help, probably stems from obviously your training, education, and communication, but go back to the process of it starts when the patient calls in. So go back to that and keep me coming down the assembly line there.
I will. After I get this one more point across.
Yeah, of course.
So when you're thinking, Steve, you're thinking sales, okay? You mentioned stuff patients needs or maybe don't need or whatnot, okay? I just want to make clear for you. So dental sales is not selling a patient something that's in addition to what they need, okay? Yeah. Dental sales is somebody who needs a root canal. Okay. You got a patient who's coming in and I'm in pain and my tooth has a big hole in it. You still have to sell that patient.
Right. Yeah.
Okay? You might not think that. You get what I'm saying? Yeah. Or I got 10 or 15 cavities in my mouth, blatant holes in their mouth. Okay. You got to sell that patient. When you needed dental work, I had to sell you.
Right. And the fact, I had questions. I got educated here, dude. I had questions. No,
you know what I mean? Even though I know you trust me and what's going on, I still have to sit there and make you comfortable because you have your own stops, fear, the unknown, time, right? Money wasn't an issue, right? Insurance was covering, helping, whatever it is, but you still got to be sold on a simple thing like a filling. Right. So when we talk about dental sales, we're not talking about upselling. We're just talking about work. Patient comes in, they've got holes in their mouth, they've got missing teeth, they need a full mouth of implants. It's something so simple from a filling to a full mouth of implants. Okay. Right. So that's what we're talking about dental sales, just helping a patient get through their stops. Because a lot of times it's fear, right? It's time or it's money. Those are the three main things, Okay. So the way we would schedule a patient, right? A lot of times the patient would call and say, hey, I've got a broken tooth. I need to come and see the dentist. Okay. So what we might have done in the past or some other offices may do, and everyone has their own system, say, okay, we'll get you in to see the dentist. They schedule them in the schedule. They come in, they go in. Sometimes the system why don't we take all your x-rays and see what's going on in your mouth? Okay. Instead of just that one tooth. So now they find out everything that's going on and the dentist sits down and they tell them what needs to be done. They give them a treatment plan and the patient says, I'll just take that. Let me just fix the tooth that's broken. Okay. Or whatever, and ignore the rest of the treatment. Or they might come in and need a whole bunch of fillings done and they won't understand why they need it done or whatnot. So basically each patient is scheduled differently. So when a patient calls the office and, Dana takes the intake call. Okay. Well, Dana goes through a list of questions with the patients and asks them to kind of find out what's going on with them. Right. So I have a cracked tooth. Okay. Well, are there any other missing teeth in your mouth? Are you having any sensitivity anywhere? when you run your tongue across your teeth, or do you feel anything cracked or broken, right? Do your gums bleed when you floss or when you brush your teeth? So we'll ask them a bunch of questions that the patient's going to answer. And then we're going to get that patient to a new realization of, hey, I don't just have this broken tooth. I've got all these other things going on in my mouth.
Right. I got an unhealthy mouth.
Yeah. And I need to talk about that.
Right.
Sometimes they've got nothing going on and it's simple. We just bring them in and they take care of the one problem. But if we get the patient, so how we schedule them in our system in the process is going to be determined on this phone call. Okay. They've got two ways of scheduling the patient. Well, more than two, but we'll stick with two. One way is going to be for a limited exam with the doctor in the doctor's chair. Okay. Because, and that's the case if a patient's just extremely in a lot of pain, right? We're just going to bring them in right away and figure out why they're in pain and take care of that. Or they just can't get past talking about the one thing that's bothering them, even though it's not like an emergency, right? They just can only focus on this one area. Then we'll bring them in for a limited exam in that area. Okay. If we can get the patient to open up and tell us about everything that's going on and, comes to the new realization to us that, okay, I've got stuff going on, right? Then we'll schedule them for a comprehensive exam. And our goal is to do comprehensive treatment in the office. Okay. So the comprehensive exam is in a separate chair, and that's where we spend most of the time with the patient. So not every new patient gets the same amount of time in the chair. If it's a limited exam, we're scheduling with a shorter amount of time to figure out what's going on with that limited problem. If they're ready to talk comprehensive, then they're going to have a much longer appointment. Okay. Yeah. And that's where they're going to go through the whole process that we talk about with the treatment acceptance. Okay. So that's where it starts. And, even at the end of that conversation, once they talk about all that stuff, they'll get into finances with them over the phone because the patient will start asking, is this how much it's going to cost, blah, blah, blah. So Dana's job is to get the patient to bring in their significant other or anyone in their family that helps them make decisions on their treatment. Okay. So the goal is to get somebody with them there. Okay.
A decision maker, basically, right?
A decision maker or any support, a supporter.
So you guys are gathering data / info right from the phone call on the call. And offices might do this, but you have specific time slots on the calendar decidedly where they need to go based on how they answer those questions. And Dana's obviously trained and educated on, based on what they say, we'll slot them into this area. Is that
Absolutely.
fair? Okay.
Yep.
And go ahead.
No, go ahead.
And so the only part I want to come back to is when did you establish this type of system or process? I mean, you were running, like you said, you were doing hygiene and you were doing dental care, like you were doing it all. As you added staff, did these systems start to come into the place, or did you keep yourself on somewhat of a system even when you were just doing a lot of the work solo?
Well, we always had a system. That's just the first step of the system.
Right.
I'll get through the rest of it with you.
Yeah.
If we talk about this, but I implemented most of this system that I'm going through with Sean Crabtree.
Okay.
Basically, when I switched over to North Oaks Dental and I wanted to create a different, system and process within my office. So that's when we switched into it. And it works really well when you have multiple dentists, and multiple staff, because it's a system that they're going to follow as long as they learn it. Okay.
Yeah. So, and just to give people an idea of what you are doing, and then let's jump into step 2. You guys are seeing about, I think we talked about on the phone, maybe you got the accurate number when I hung up with you, but you were about 80 patients a day.
Between all the providers, yeah.
Yeah, correct. Not just Alvin.
Yeah.
That's what I meant by optimization. You guys are running this system. I don't know.
But it's like, we're 80 patients a day, but we also have over 1,000 reviews online because it's a good experience, right?
Correct.
So
these are recurring clientele. Yeah.
It's not chaos.
No.
And what's great about it is because like everybody has a duty and everybody has a job, right? Each doctor has their assistant, you've got everybody knows how the dental office runs, right? So basically it's just organized a certain way. We even have it organized where, across each doctor's, when you talk about the floaters, we call them, who go between dentists and help out, like our schedule is like a planner, right? So like Dr. Carmel's not going to have a crown seat at the same time I have one. it's going to be somewhere else. So that's the other thing we do. So we're talking about new patients and how they're scheduled. And I'll get into the whole treatment acceptance in the room with the patient next. But we also, like, our schedule is a planner. It's not like just a book where we just throw patients in there. Everything's pre-blocked for every doctor and every hygienist. Even in hygiene, like, I can get into a whole side story over how you optimize hygiene. Okay. But basically,
so it's not let's get busy. This is an efficient calendar you guys have. Yeah.
I'll show you our calendar next time you come in. Yeah. I'll show you all the blocks. The whole month is already set up. And all we got to do is say, these patients need these procedures. Where are we going to plug them into these blocks? So the patients don't dictate where they go. You know, if we have a wide 2-hour opening tomorrow and this patient needs a crown seat or an appointment that doesn't require the dentist, they can't go there. They got to go to the gray spot where they belong. You know what I mean?
That makes sense.
Or if this patient needs 2 fillings and they want to come in next Thursday morning and it's an hour and a half appointment, they're not allowed to go there because a different procedure goes there. They're going to go in the, 40-minute spot.
I got you. That makes sense.
Okay. So based on the treatment they need is where they're going to go. So the whole month is already planned, and all we have to do is take the procedures the patients need and put them in there. And then we'll always, it's scheduled out by efficiency and a certain production amount that's already pre-planned for the month. All right.
I love that.
I mean, we can at another day talk about scheduling.
Let's flip.
That'd be actually
the
a good
back.
Subject for the future.
Yeah.
How to schedule and how to optimize hygiene as well, and how to get the patients to do what you ask them to. They
Bridge
like
Dental,
control.
Bridge Dental podcast listeners, we might be doing a 3-part series with Dr. Daboul, so it's very possible. I love it.
I talked too much. I'm sorry.
No, that's not. No, there's just different topics to discuss, and you run a really efficient. We're using the word optimized, but efficiency is ultimately what we're talking about here. Yeah, and that's what dentists are trying to do, because not every dentist is the perfect business owner. They know how to do dentistry, right? So
yeah.
But anyway,
all right. So the patient comes in, right?
Patient comes in. Yeah. Now we're
schedule the patient based on their appointment. Okay. And based on what's going on with them, and based on if they're, stuck on that one area, limited exam is treated different than a comprehensive exam. So we're going to talk about comprehensive treatment, comprehensive exams. Okay. So they come in, and then our treatment coordinator, goes in, grabs the patient, brings them into the room. So the first person they talk to is the treatment coordinator. Okay. Treatment coordinator basically interviews the patient for about 5 minutes. Okay. Their job is to create value for the patient. So everything we do is value based. Yeah. Right? And so value is very important, because if they don't have value, then people shop based on price. Okay. So if you're going to go buy a car or a type of cheese from the grocery store or whatever it is, if you see value in the thing that's more expensive, or it doesn't matter how much it costs, if you value that, you're going to buy.
You're going to buy it. Yeah.
Okay. If you don't see value in it, then you're going to just give me the cheaper one.
Correct.
Right. Okay. So we want to create value. What am I paying more for? Exactly.
Right.
Or why am I doing all this? So the patient comes in and she creates value with the patient. So we have our vision put up in our lobby. So she says, basically, we have our vision. You saw it in the lobby. And her job is to go through a process where she's asking questions to get the patient to open up and talk about why they want the dentistry done, other than just like, I just want this tooth fixed. I want a root canal. I need fillings, right? It's more of like, you get the patient to start talking about confidence, self-conscious, things like that, right? So, and we're talking comprehensive treatment. Now, if a patient has nothing going on, there's not going to be much conversation there. Okay?
I understand. Yeah.
But when we're attracting new patients, and we're talking about mainly new patients here, right? A lot of new patients that you attract to the office, they haven't been to the office in a few years. Okay. And they've got a lot going on, or they've got a really broken down mouth, and we need to help them restore their entire mouth. So these are the conversations that can get a lot deeper, right? So we find out exactly, how they feel about their teeth, what's most important to them about their teeth. Okay. And we try not to make it about health. We try to, ask questions, and they tell me, like, I cover my mouth when I talk to people. Right. My kid told me I need this done. They keep looking at me and wondering why I still look like this, or I'm in a lot of pain. okay, in my mouth, or I'd have sensitivity, whatever the case is, right? So then they'll open up to us and tell us about, like, they're self-conscious, and then, go and dive in deeper. Like, how long have you been, self-conscious for? Okay. How long have you, just been insecure about smiling in front of people? Okay. How's it affecting you today?
Right.
And then how long can you live like that for, or how would it affect you if you had the work done? So that's what she does. So she creates value with the patient through conversation. And then the next step would be to bring in the doctor and just explain to her that, to the patient, that the doctor is going to come in and help you get your confidence back.
Yeah.
Okay? Or help you, talk to your grandkids without, feeling embarrassed. Okay. Then the doctor comes in, and our treatment coordinator will hand that off to the doctor in front of the patient. We won't even talk about it on the side. Just, all right, new patient in room 1, it's a comprehensive exam. Come on in. Right. And then, so I'll come in, we'll just use me for an example. We all pretty much do the same thing. I'll come in, I'll sit down in front of the patient, and I'll say, hey, nice to meet you. I'm Dr. Daboul. Welcome to the practice. How did you hear about us? Great to hear that. Most of the time I want them to say referred. Okay. Right. Now that's a whole nother subject we can get to, how to ask for a referral. It's the best patient you could ever have. Everybody knows that. Okay. Versus a marketing patient coming to your office, somebody's referred to you. They already have some trust in what you're going to tell them. Right. So basically, how did you hear about us? Great. Okay. So, Nicole here, or Isabella here, is going to, I know she already had a conversation with you about what's going on. She's going to fill me in on what's happening. And then I'm going to take a look at your x-rays and get you set up for your appointment. Okay. So I'll be telling them what's coming and already, telling them we're going to take care of them. We're going to set your appointment up. We're going to get your work done. Okay. Remind me on a side note to tell you about how the doctor schedules the patient. Okay. Even in just like for any exam, not just a comprehensive exam, because that's been a big winner for us. That can, if you guys out there start doing that, you'll instantly increase your acceptance.
I got a pin in doctor scheduling.
All right. We'll come back to that towards the end, but that will increase your practice right away just by doing that. So basically, then, she'll do the handoff. Hey, this is Diane. Diane's been, not able to smile completely on the right side of her mouth. She only smiles on her left. And it's been bothering her for about 7 years when she takes photos with her friends. And, currently she's, interviewing for jobs, and she just wants to have more confidence when she goes in. So she's lacked confidence for all these years, and she's ready to get started and get her mouth fixed. Right. So that's what I want to hear is a good handoff, is all that. I want to hear the past, how it's affecting them today, and that they're ready to get started. That's the future part. If I don't hear all that, then I'm going to ask more questions myself and do my own probing and entering from the patient. What
I'm sensing or understanding is once you get a little bit of understanding from a client, but this entire process, when you talk about building value, what I'm hearing is building trust with somebody. So they don't just think you're selling them a procedure. You're building trust in this short period of time, right? It's only like an hour with somebody. You're building trust quickly to then get to the next step or help the client understand how you can help them feel better, bring more confidence to their world, whatever it might be. So I'm hearing a lot of that.
We're creating emotions.
Right.
So
yeah.
There's value and there's emotional value, right? So we're like, people buy emotions. Okay. So you want them to come to a realization of how this has been affecting them. Because like if you walk in and you're like, I need these fixed, you start asking them all these questions. They start telling you this. You're not actually, we never say, are you not confident? We won't say that. Right. Patient's going to tell us. We're just going to ask them how they're doing. It's coming from them sincerely in their heart. Right. Yeah. So they're like, they come to this realization like, man, this has really been affecting me for 10 years.
Right.
And emotionally they're like feeling it like, man, I really got to do something about this. And I've opened up to these people who are going to help me. And for us, like, we love to hear the story and see how we're actually helping this patient. It's great morale for the staff. It's great for me and the other dentists, because you're not just drilling and filling. You're not just like doing a root canal, or you're not just, putting implants in the patient's mouth. We see this patient who came in with lack of confidence, or they're just in pain, or whatever issue they're having. right? And we know more than just a broken tooth, and we fix them. We see them afterwards and we see their confidence go up. It's a morale booster for us. And we feel like we're doing more good, right?
Yeah.
In the world. And then that patient is felt taken care of, and now they're referring another patient to us that we can help the same way. So it's great for not just the patient, but it's great for the team. It's great for the staff. It's great for the doctors. It's great for the bottom line profitability of the office. You know?
Yeah. You're creating a referral partner for life, by the way. When you can help a patient that way, regardless of that particular number or deal or whatever, procedure, you're creating just the marketing you're talking about, like you're creating a referral partner for life. Like if you can emotionally help someone build confidence, and that's a completely different story, which, you know, your motto on your website is our family caring for yours. That is a mission statement for a practice that I can hear it. Just like, you're not talking about bottom line. It's like, well, the bottom line will be there if we obviously we price things correctly, we do things correctly, and we're efficient. But when we're helping patients, the bottom line just happens because you're helping people. That's the passion of dentistry.
Yeah. And you know, Steve, that's how you grow your business. The more people you can help, the better you're going to do. Right. So your bottom line is better when you're helping others. Right. And that's how anybody is successful in the world. If they're not successful at helping others, then their success isn't going to last. Right. They're taking a shortcut way of doing things. Right. So you got to be sincere. You got to really care about the patient. If you don't, you're in the wrong business. Right. So you got to really care about the patient, and getting their emotion and getting their story really helps you connect with them and really helps them get the treatment done. But what it's doing really is helping them get their comprehensive treatment done. Okay. Because without all that, you get less acceptance of the treatment. Okay. Because they have a bunch of stuff going on, but they might just take care of their immediate problem or the one little thing or whatever they can afford based on what insurance, based on what the insurance pays for. Right. Then that's not doing them justice, because they still have all these problems in their mouth that they're walking around with, showing up at emergency appointments, or just, having stuff that's going to cost more money later to fix. Right. Okay. So by getting them to this, to see value in what you're giving them, and for them to accept a comprehensive treatment above and beyond what insurance covers, then you're actually making a change for them. We see all these patients in our hygiene that have all this blue on their chart, which is work that was done. And now they're just regular hygiene patients and everything's maintained. But we help them get all that stuff done. Right. Versus, you got up to that point. Our hygiene department, believe it or not, doesn't have that much. When we go through the charts in the morning, it's not a whole crazy lot amount of treatment, because most of our patients accept the treatment that they do. And then they end up in hygiene, where, you might find a practice that, they got a patient, they got them in hygiene, they took care of a few things for them, and they have all this outstanding work. So they come in, the red is what they need done. There's a lot of red on these charts, and you're just kind of, poking away at it. And then they're needing, worse and more expensive treatment down the line. Right. Oh, man. So we take pride that our patients are healthy.
When I come in Thursday, I got a Thursday dentist appointment, man. I'm going to look at that chart. I'm like, I got red anywhere?
Yeah, you got a bunch of blue. No, I'm just kidding.
I'll break it all down. Like, where am I at? How am I doing as a patient?
So I'll show you what that looks like. So back to the treatment acceptance part, right? So we're trying to create value and help this patient actually make a change in their life and have a healthy mouth going forward. Okay. Of course, you get a handful of patients. I just need a filling, or they need nothing. Okay. Sure. Nice to meet you. Welcome to the practice. Get you in hygiene. Okay. And we don't always know.
Well, I want to know, just from let's use a measurable here real quick. And I mean to interrupt, but let's use a measurable if we can. So this is a curiosity question. Is there a measurable on comprehensive treatment versus more just a limited exam stuff? Do you guys have a ratio you're trying to hit? How do we know, if I'm a dentist who has a practice right now listening to this, what's the measurable I need to be at? Or if I know I need additional help, is it 80% conversion? Is it 50? Or, I don't know that number. What would you say?
You want to be at about 80 to 90% of comprehensive. Well, okay. So are we talking about scheduling, or are we talking about acceptance?
So you're talking about scheduling to goal, acceptance, right? Coming through.
Our goal is that 80 to 90% of the patients that call as new patients, that our intake call does a good job to convert that patient, if they're not already, into the mindset of comprehensive treatment and not come in for the limited exam.
Okay.
Okay. So when they do come in for the limb exam, we handle that problem. We solve their issue. Then we schedule them back in the comprehensive chair to do a comprehensive exam. So they come back. Sometimes it's like a patient who we handled emergency, and now they're back for a comprehensive exam. Or a patient who hasn't been here for 5 years. We're going to put them in for a comprehensive exam, right? So that measurable is about, 80 to 90%. You want to do a good job getting to comprehensive. If they're all emergencies, then you're not doing the right job on the phone to get them to the mindset to come in and talk comprehensive, and that patient's missing out on a healthy mouth, and you're missing out on and doing comprehensive treatment for them.
Correct.
Right.
Okay.
And, when you're scheduling them to do, multiple things under one visit as well. I mean, sedation is amazing. If you can, figure out how to get sedation into your practice. I got patients who've been in, have been in this 5-6 years, and they need all kinds of dental work in their mouth. And instead of bringing them in for 6, 7, 8 appointments, we sedate them for a few hours and knock it all out.
Okay.
Right? So it's efficient for your practice to do it that way.
Right,
and
you're saving 8 future appointments, right?
Yeah. Yeah. Imagine the patient's happiness. Like, you serious? You could knock me out. I can get everything done. I don't have to feel shots in my whole mouth. Like, I'm going to get them, but like, I'm going to be asleep. Right. Man. They love it. They're so happy for that.
It's a whole nother conversation on the sedation side, but also part of I'm sure you bring that up in the comprehensive exam part where
if it's relevant.
If it's relevant to the situation.
Yeah. Most patients don't need it, but the ones that do, it makes a big difference for them.
What about, Alvin, so you get called to comprehensive exam, you're looking for 80, 90%. So now they're in the chair with you or another doc to get them to actually do the work, the treatment acceptance. Is there a ratio there?
So basically, as far as acceptance, there's different ways of measuring it. Okay. The way I measured it in the past is different than how I measure it now. I used to measure it like what percentage of patients accepted some treatment. Okay. So you looked at it on a patient basis, right? So if I saw 10 patients, and then for the treatment coordinators too, they always want their statistic to look good, right? Like I'm kicking butt, right? Too. Yeah. And you want them to, be doing great and be successful. But a stat that we used to do is like, okay, if a patient, 8 out of 10 patients accepted treatment, that was a good ratio. Okay. But now we don't measure that. Now we measure what percentage of the number of dollars of treatment was accepted. Because before that, one of those 8 patients out of 10 that accepted treatment, right? One of them needed a $10,000 treatment plan, and they accepted to do like 1 crown or 1 filling, and we counted that as accepted.
But we didn't.
Right? But really only 10 or 20% of that plan was accepted.
Right. That makes more sense.
So when you look at a measure, because if somebody says, I have an 80% acceptance rate, that's great. But are you talking about just like patients accepting, right? So if you go back and measure actually the amount of comprehensive treatment dollars you're presenting, right, to accepted, the average is probably in the industry about 30 to 40%. Okay. And our goal, I won't tell you my goal because we don't really hit our goal, but what we're doing is probably what we're doing is about 65 to 70%.
Wow.
Okay. Of acceptance of comprehensive treatment. Right?
Dollars recommended for treatment versus dollars actually what the patient's actually doing, right? Is that what you're referencing there? 60% of those, you're actually collecting those 60% of those dollars versus the average of 30.
Sure.
Okay.
Yes. However, my statistic is only based on their first visit.
Okay.
So that doesn't mean that we're not getting more acceptance than that, because we're only keeping track of the first visit. We do a lot of treatment reinstatement, which is like helping patients get back in the office to finish their work, or a patient just, I got to follow up with you tomorrow. They'll say, and they come back in, or they get their cleanings and then we do the work later. There's lots of ways. So we have a whole nother program for treatment reinstatement.
I'm that patient, by the way. 100%. Yes. I'm that patient. All right. Hey, can't do this all today. All right. Tell me how we can get back in here later.
Well, I don't mean do it all today, but I mean pay for it all today.
Yeah. Okay. Gotcha.
Everything's paid 100% before they schedule as well. Okay. So I know some people do like $100 down or half. We do everything paid in advance, 100%. And you can do that when you're creating value.
Correct.
Because the patients aren't questioning. Our show up rate through the roof. Okay. So based on their first day presenting treatment, what they accept that day and pay for that day is what we're doing our percentage based on. Okay.
Okay.
So then now the doctor goes in, this is what you need, blah, blah, blah. Okay. We're going to get you back to healthy or, out of pain and whatnot. And then we'll get you scheduled for it. Okay.
Okay.
Now the treatment planner, after I'm done, giving them all the treatment and what the patient needs, they're listening to the whole thing. I'll say, okay, go ahead and get that ready. And then I'll spend more time with the patient alone. Okay. And I'll go ahead to be, more efficient with time, let her go work on putting the plan together.
Sure.
And I'll go ahead and explain, answer questions for the patient. Okay. At the same time, when you're with the patient, a few important key factors for you when you're in the moment with the patient, and for the treatment planner is to pay attention to the patient. Okay. You want to be in the moment. You always have other rooms to go to, but you got to find a way not to be distracted. Okay. You got to find a way to be in the moment and talking to that person, and in your mind, just help that person in that moment. Okay. Because if you're just quick about like, okay, all you can't do is wait to go to the next room. The patient feels it. They understand it. Okay. You want to sit in front of the patient, face them. Okay. Right chair side to their right side, right in front of them. And you want to make eye contact, and you want to pay attention to them, and you want to sincerely help that patient. And they're going to know by you doing that. Okay. The other thing is to pay attention to their tone. Okay. Are they, super pumped and excited type of person, or are they more, scared person, or are they just kind of more, like an accountant who wants a bunch of details? Okay. So you got to figure out what kind of patient that is in front of you and give them what they want. Somebody who's super enthusiastic and just ready to go. It's simple. Like, hey, you're going to do this. It's going to be great. We're going to take care of your work, blah, blah. Somebody who's really, really scared and nervous, if you act all super excited with them, you're crazy to them. Right.
Yeah, right.
You're going to scare them. They're going to be like, this guy's nuts. I'm not working on him. What is he talking about? What's exciting about this?
Right.
Right. So I got somebody who's super scared. I tell them, look, dude, you got to get your work done, and we're just going to make sure you have a very, our appointments are very boring, actually.
So you slow it down. Slow it down.
There's nothing exciting going on here. You're going to come in, you're going to be bored. We're going to get your work done. You're going to go home. That's what they want.
Yeah.
Because they're scared. Right. So you got to just like you do naturally. Right.
Yeah.
Steve, like somebody calls you and they hit the lottery, no matter what's happening in your day, you're going to be excited for them.
Right.
Okay. If somebody calls you with bad news, your tone is going to change. You're going to talk slower and softer. So you got to recognize that with your patients, just like you do with your friends and your family. Okay. And pay attention at that moment, because for them, it's a big deal. They're there. They're nervous. This is new for them. They've got all this stuff going on. You can't just be your super uptone regular person that you are, or super low tone. You got to kind of pay attention to them so that they can feel comfortable with you. And the reason why you want to make them feel comfortable with you is so they can hear what you're saying. Okay. Because if they're not comfortable with you, their mind's drifting somewhere else. They're thinking about something else, and they're not understanding anything you're telling them about their treatment. It's going one ear and out the other.
Correct. So
that's why it's important. It's the communication. That's how you communicate with them.
And how did you improve your communication? It could have definitely been through the consulting. Did you take Toastmasters
and consulting, some training classes, and through the consultant? And a lot of the stuff I'm telling you is kind of developed through the years through different seminars.
Right. Some of it takes time too.
And the process, that we're doing, it's all kind of put together from different places, Well, so the main thing is the best way to train yourself is just stop, be in the moment, and pay attention. That's the side note that I'm trying to get to. Okay.
Right.
When you're pay attention to the patient.
When you're communicating with the patient, you also learn that right in that moment. Wow, man, what went well, what didn't go well? How can I improve?
Yeah.
Post that patient. They call it the dry runs, right? You also learn through the experience, right? Some of it is literally just patient experience.
100%. Yeah. But, the biggest thing you got to get out of your patient experience is how could I have understood that patient better? Yeah. Because what you do with one patient is not what you're going to do with the next. Right. Every patient's different, and you got to pay attention to what their needs and wants are and what kind of communication they need to understand what you're saying. Just like all your staff. It's the same thing. Like I communicate different to every staff member because I know, what what gets that one excited versus that one? What brings that one down versus that one? The way I'm communicating to this person is different than I can communicate to this person because they're a little more gentle. Or this one's more blunt and straightforward and just tell me what the hell's going on, right? So it's just like your everyday communication with everybody in the world. You got to treat each patient that way and not treat every single patient the same because they're not. Right? Yeah. So that's what you need to learn the most, in my opinion, is paying attention to them and learning how you could have better communicated with them so that they are paying attention and understanding what you're telling them. And it builds instant rapport. It's instant rapport. As soon as you pay attention to that patient and you're recognizing things with them and they feel it, right? Because you're on their level, it's instant rapport building. I mean, when I say instant, I mean, it's automatic. Okay.
Right. They got some trust.
Yeah. So then we'll sit there and I'll explain to them another great, technique that really helps communication is drawing. Like, no matter how scribbly you do, if you pull out a piece of paper and you draw to the patient what's going on, just like, all those, advertising things you show up where they're drawing a picture and they're trying to explain something, there's a reason
you've done
for
that with me.
I might have.
And there's a reason. They understand the concept.
Right. But it's not just understanding the concept, but it's engaging them because you're actively drawing and they're paying attention because you're saying, see this, you've got them involved. And they're understanding and paying attention. A big part of treatment acceptance is the patient not understanding what you're telling them or why they need it done, or they're just not listening to you, right? So like the drawing of a description of what you're talking about is just keeping them engaged and there presently, because you got to be present, but so do they.
That's right.
Right. So you got to make sure they're present. So when you see a patient, you mentioned the word root canal and they kind of scratch their head or they look up into the sky or they start adjusting in the chair, there's something there that you got to figure out what that was. Okay. So it's like, okay, so let's take a step back. Have you heard of a root canal before? Yeah. What do you know about that? Because, that was the last thing you said when they adjusted. Mm-hmm. Right. So now you go take a step back and say, what do you know about root canals? Well, my mom, this, and I heard this story. And okay, well, and you got to explain to them, that's a different story than now. That was a different time or it's a different situation than yours, but you got to take that connection they made with root canal. And you notice that because the patient went, semi-crazy in the chair. If you're paying attention, you catch it, right? And then you kind of address their concern and you help them realize, okay, that's not me. It's just realizations. Everything is communication and realization with the patient. That's what stops patients from doing the work. It's fear of something, the unknown, time, and money, right? So like if they're not understanding what you're saying or they're just like scared of something you said, how are they going to get their work done?
If you are listening to this and you're a dentist, I can almost it's like close your eyes. Imagine that patient you had that did turn away, adjust, cross their arms. Did you recognize what was in the moment there? Because I'm sure you've all been through it where you notice the patient is not engaged. And maybe it didn't work out perfectly. Maybe you didn't pull them back in or whatever. So because when you were describing it about the root canal, turning away, looking up, I'm sure every dentist listening to this has had that moment where they're like, why isn't this patient I'm trying to tell them what they need, Yeah. But as you mentioned, it's like, all right, that's a recognition thing. Let me dial this in a little bit. Let's get them engaged. Let me just ask a couple more questions here. They're looking off and out the window right now. Let me pull them back in. And that takes time, confidence. It also takes practice. And sometimes you got to get it wrong to get it right. But I can almost feel like people are seeing that vision go through in their head, right?
Absolutely. And with any line of work, same thing. Right. So then, okay, so I pay attention to the patient. I do my communication. I explain what's going on. So I sit down with them and I spend a little more time just kind of like explaining to them what I told, the treatment coordinator. Let me explain everything I told her so you understand. I go through it with the patient just so they have some understanding, but I still keep my focus on the value, which was the confidence and whatnot, right? But I just make sure they understand what's going on, see if they have any questions, and then I pick a date for them to do their work. Okay. So that was the part that I was talking about earlier.
We had a pin in that. Doctor scheduling.
Yeah. So we do this in hygiene as well for our limited patient exams and our comprehensive. This is something we just decided one day to start doing in the office, and it's taken off. part of why we started doing it is because we created this like planner of a schedule, right? And everybody was trained on where to put the patients when we first started like creating our planner. How I told you each patient goes in a certain place. So we started doing it for that reason, like let the doctor pick where the patient's going to go in the schedule until everybody's trained on it.
Yeah.
But it turned out being by accident, such a huge success for treatment acceptance. Because now the doctor, before money is even presented to the patient, is picking a date and time to do the work. So it's almost like a soft close. Like you're finding where's that patient at mentally by picking the time and date. Our goal is for the patient to become I got to just use the word sold, right? On their treatment before the doctor even talks to them. Our goal is that the treatment coordinator gets the patient to the point, when she's doing the hand up to the doctor, they're ready to get their work done. In their mind, they're just thinking, okay, I got to get this done.
Yeah.
Whatever it is, whatever it is. He doesn't even tell me what I need. I know I got to get done and I know I'm scheduling based on my conversations that led me to that point. Okay. Through the office.
Right.
And then the second goal is, for them to be convinced that they're getting the treatment done before they even see the cost and how they're going to pay for it.
Correct.
Right. So then that's when I'm sitting there and I say, okay, well, let's pick a date and time to get this work done, whether it's today or tomorrow or a week from now or 2 weeks from now for the sedation. So let's pick a date and time to get this done. And then I can look through my schedule with the patient and I don't schedule it, but I pick a date and time for them to do the work. Okay. They usually already have a date and time picked out with the hygienist because we'll have the hygienist come in before I go in sometimes or after. It depends on our availability, right? To pick a date and time to do their cleaning or their scaling or whatever they need done.
Sure.
So I'll see when they have that picked out already. And then the patient will pick the date and time and then the treatment coordinator will come back in and I'll say, all right, we're going to be doing her work on Thursday at this time. I'm going to do the first half here. I'm going to do the second half 2 weeks from now. Go ahead and get her scheduled, go over like the cost and how to pay for it. And then now her job is just to not ruin it. Just go over the money, just go over and make it very simple. Like we have financing, you can pay for it this way. And how do you want to pay for it? And that's it really. Once in a while you get a patient say, well, I want to see how much it's going to cost. We rarely get that. But when they say that, I totally understand that. She's going to break it down for you in a payment, type of method. We do financing companies and stuff, or she'll help you figure out how to get the payment done to do your work. I'm just going to pick the date and time because I manage my own schedule and I know what you need, how much time it's going to take. So let's pick a date and time. I'm not scheduling it, but if you agree on the cost, she's going to schedule it.
Okay.
So then I still get them to pick the date and time.
Right. That is.
But that wasn't as much of a success as the other way.
Sure. But there's a personal connection there too. When the doctor schedules the next meeting with me, I feel kind of like, well, he really cares about me. He's not just shoving me to the next patient. He's going into his calendar. It gives it a more personal touch, by the way. Like emotionally, I'm thinking about that as a patient. It's like, that actually is a pretty cool connection there that the doc cares about me. He's putting me on his calendar. Like that's legit. He really wants to get this next step done for me.
Yeah. And it really is doing both for us. It's me helping control that patient is put in the schedule at a time that I know exactly what I'm doing with them and not every crown or filling is the same. Just because it's a MOD, this might be a 5-minute, MOD or a 40-minute MOD. You know what I mean? And my assistant they don't know that, right? How long it's going to take. So me picking the time actually gives the patient better service because I'm actually giving them the correct amount of time they want. I'm not trying to stress myself out and have like an hour for something that takes an hour and a half, right?
No.
I want for something that takes an hour and a half, I want an hour and 45 minutes.
The answer is not to be busy, it's to be efficient.
Absolutely.
Right.
So, our philosophy in the office is, strategic over technical.
Okay.
Everything we do is strategy. And if we're not thinking strategy and we're just thinking technical, then we're not thinking the right mindset. Yeah. Right. So I'm doing that with them. We're picking the time and date. We do the same in hygiene. If I go into hygiene, they just need a crown or a filling. I pick the date and time before I walk out, even if it's just a quick conversation. And just the patient's already accepted the time and date and accepted the treatment before they even saw the cost, right? And then when that's not done that way, our manager over that area is coaching it. Okay. So we have a different, let's say you could break the business down to 8 areas. I have a different manager for each area, versus one manager for the office, because each person can concentrate on managing that area. They have a plan of how it's written out. They have the system, and their job is to coach each other over that area, basically. So that's the process.
And so you tie all this together. You have this beautiful practice you've built. You got happy patients because they're not being scheduled on top of each other. They're being scheduled efficiently to optimize their treatment. You're getting a higher acceptance rate. And even, by the way, with all this in place, not everybody accepts, right? You're not 100%. It's not perfect.
No,
someone's going to say no.
That's why we have treatment reinstatement program.
Right.
Right.
So,
yeah.
So now you talked about the practice, opportunity with a younger dentist as well.
Yeah.
And I also know from our conversations, you're kicking off in 2024. You're the CEO of this dental marketing group. Tell us a little bit about that. Let's wrap up with that. So
okay,
that way, and then I want to wrap up with how people can get connected with you, dentists who are listening to this.
All right, awesome. And then let me do a quick recap on the sales line.
Yeah,
because I know we talked about the whole line and we jumped so many subjects. So it starts with the intake call, figuring out where that patient's going to go, limited or comprehensive. Once they get in for the comprehensive, it's the treatment coordinator creating value for the patient, handing the value off to the doctor paying attention to the patient, picking the date and time, the treatment planner coming in and finishing it. Okay. So in a nutshell, that's the process, right? And then as far as what did you ask me?
Tell me about the new dental marketing piece you're venturing off into for 2024.
Yeah. So marketing, obviously we can't do everything we're saying without new patients. Okay.
Right.
The best new patients are referrals, but to scale your business, you got to market. Okay. There's a lot of guys out there who don't market, guys, girls, and you do just fine and you're doing great and not surviving. You're very successful and very booked out. You can do that alone with just referrals and not much marketing. Okay. But to scale, to hire an associate and to grow, to replace yourself or to have 2 or 3 of you guys around in the office, marketing really helps get that done much faster because you're doubling, tripling your new patients compared to what you were in referrals, basically. Okay. So I've been marketing for our company's called Dental X Marketing. Okay.
Dental X Marketing.
Dental X Marketing. We haven't launched it till beginning of January. The website's being built right now. I'm partnered with GTU.com. They are a marketing company that's been doing, dental and general for a very long time now. And they're a very successful company. And we've partnered up together to create a dental specific company. So we're going to kind of use their expertise in the background to handle some of it. And then my experience as far as the hardships you go through with marketing. Okay.
Yeah.
I mean,
big pain point, by the way, big pain point.
Yeah.
For a lot of practices.
It's huge. Yeah. I've managed millions of dollars in marketing budget. And I've learned what works, what doesn't work. Not just that, as the times change, when it's time to make a change from one marketing strategy to another. Okay. Right. And a lot of people, dentists, the biggest frustration is lack of transparency with the marketing company. Okay. Lack of good communication. Okay. And, lack of
results, frankly.
Lack of results, because once they sell you,
right,
everyone's so amazing at selling you the treatment or the plan for marketing. And then the salesperson is gone. And now you're dealing with the rep who is not as motivated as a salesperson. The communication just drops off. You don't know what you're paying for. Right. And then, or you're too damn busy in your practice all the time that you forget to ask or set up meetings and consult. What are we changing? What are we doing? So that's a big struggle. So what I want to do, the way I'm planning on helping other dentists is a couple ways. Is one, through partnership, right? I'm going to help my friend of mine here. And then the other way is through the marketing company. So we're going to help dentists market their practice and grow. And then through that, they're going to have more new patients. They're going to need some help as well with learning how to not just get the patients in the office, but get that patient to be scheduled properly and to show up. And to get that patient, because you get leads, okay? Lots of leads come in, but if you can't convert that lead into a patient who's getting treatment done, then you're just wasting your marketing dollars. So we're going to help these dentists and their staff get trained on how to handle the phone call, We're going to help them on how to increase their treatment acceptance, because yes, our goal is to get you more new patients, but the ultimate goal of why does the dentist want more patients, right? More new patients. It's not just to be busy.
No, we don't want
to
you
grow.
don't want transactional business. You want relationships, right? That constant referral machine of the good work you do.
All right. So that's what we're going to do. We're going to help the dentists get the new patients in so they can increase their business, increase their growth, either work less hours and make more money, or, be busier, or add rooms, add hygienists, add staff, add doctors, or expand to other locations, whatever like everyone's vision is, right? We can tailor something to help you with that, but it comes with getting more new patients in the office that are accepting treatment, right? So we're going to help them get them to that process as well, once we get the patients flowing for them.
And Alvin, I appreciate you sharing that. So we're recording this on 12/5/2023. It'll probably launch in the next 2 weeks. So very close to the January.
I'd say about a month.
Okay. Yeah. So where would they go in the future? If they're popping this in and they're listening to this, where would be the future website if you have it? If not, I can get them in a different way to connect with you in the show notes.
It's dentalxmarketing.com.
Okay. So in the future, in the next month or so.
But right now, like, we are helping some people get started before it's even launched, because we have already, like, the company's already set up to help. Yeah. So they can also go to gtu.com.
gtu.com.
And just, basically ask to find out about how they can get involved in the dental marketing aspect.
Okay.
Side of it. And always going to go to northoaksdental.com and, call the office and ask for me. My office is open to anybody. Okay. I've had probably 30 or 40 dentists just come shadow for half a day, just hang out, through all the years. Right. Yeah. I love to build relationships. I love to talk, dentistry. I love to talk business. I love to talk growth, careers, like people who just wanted to kind of figure out what they're going to do and where they're going to go. So anybody's welcome to just send me an email at Daboul@northoaksdental.com. And you could put that down on your podcast, right? You can write it out for them. Yeah. And just send me an email, and you're invited to come spend some time with me in the office and just, get some advice, or, at the same time, give me some advice on what you've learned so I can better myself.
Well, I think I speak for everybody listening. This was an awesome episode to understand a process, an optimized office. I like using that word today. And dental sales, like optimizing the dental sales process. And now I love the follow-up. You're not only going as far as, hey, this is what we're doing. You're going off into the dental marketing world to teach it as well, and bring new patients to dental offices, and also teach the process of converting those patients for treatment acceptance. So a lot of big things going on, man. I knew this wouldn't be a boring podcast. We got a lot of information we just went through. And I think it's a great way to, first of all, end off our podcast year, and also pretty much launch into January. So you've been a pleasure to have, Alvin. I really want to thank you for jumping on with us.
Thank you, Steve. As you can tell, I love talking about this stuff. I have a lot of passion for it, and I love to share it with anybody who's willing to, listen and apply, hopefully there's some things in there that they can start doing right away to help their practice. And then, like I said, reach out to me. I'd love to learn more. And like I said, I'm always learning and always changing. So I'd love to learn back from anybody else too.
Well, thanks again, Alvin. We wish you the best. Great holiday season. Good luck through the rest of the year. For all the Bridge Dental podcast listeners listening to this, this will be our last episode of the year. So happy holidays to you and your families. Happy New Year to everybody. Remember, this episode is sponsored by yours truly, Steve Kuza, your resident dental financial advisor. Reach out to us for your financial planning needs. And Dr. Daboul, again, it's been a pleasure. God bless. Bridge Dental podcast listeners, have a great end of year.
Thank you.